Morning to you, Leanne. Yes, dead right. It's been a busy couple of weeks for him. In fact, it wasn't just the HPV vaccine that we're talking about, and this is actually a game changer in many respects, because we know that 70% of cervical cancers are caused by this particular vaccine, this papilloma virus that the vaccine intends to eradicate. And we know that cervical cancer is the second most common cancer amongst South African women. So vaccination really is the way to go. We're the first country in Africa to roll out this program, so we're going to chat to him a little bit more about that. But also a short while ago, he introduced the Implanon, and that's that contraceptive little stick that goes in underneath the skin, because we have a problem with particularly teenage moms. 80,000 babies are born to teenage moms. So this little contraceptive device will probably be a game changer as well in that respect. A little bit earlier on, we heard from the finance minister giving the health budget 145.7 billion rand in this current budget. Now, the question is that enough? Well, we're going to find out because he has a lot of ambitious plans. The National Health Insurance plan is the big one, and I guess that might be a legacy project for him if he comes back as the minister. Pilots have already been set up, and we'll get a little bit more detail on that. You may have been reading newspapers over the last few months, and there's a suggestion that the minister is at war against pharmaceutical companies, is at war with private doctors, etc., etc. But he says that he isn't, and we'll get to the bottom of that as well. Now, this is a conversation that you very much want to be a part of. All of us at some point in our lives, in fact, from the day that you're born, you get a vaccination. So we interact with the health system throughout our lives, and so we've got to make sure that we have the best one possible. And we'll be chatting to Dr Aaron Motsoaledi just after 7 about the healthcare system in South Africa and how it affects you. So if you've got any questions, please put them through, and we'll ask the minister and we'll get a live response for you. All right, let's find out what's been happening on your neck of the woods, because I think you've done the sport already. Was that what's next?